Disclaimer: exercise is not without its risks, and this or any other exercise program may result in injury. We are unable to perform a physical assessment with you at this time, and therefore you take individual responsibility for your exercise program. When exercising at home, choose a clear space at a comfortable temperature and have drinking water available. Please wear loose, comfortable clothing and flat, non-slip supportive footwear. Only exercise if you are feeling well. During exercise, it is normal to feel slightly warm, slightly out of puff, experience light perspiration, feel your muscles working and your heart rate increasing. It is not normal to experience dizziness, palpitations, undue breathlessness or chest pain. In these instances, you should stop, rest and allow the symptoms to ease. Should they not ease, follow any guidance that you have been given and seek medical advice. If you experience pain in your joints or muscles, stop, check your position and try again. If the pain persists, seek medical advice. However, feeling that your muscles are working and slight soreness the next day after exercise is normal and shows that the muscles are working. Breathe normally throughout and try not to hold your breath. Patients who have undergone cardiac surgery, for example bypass or valve surgery, and have had their chest bone opened need to be careful with arm and chest exercises for 12 weeks to allow the bone to heal. Exercise within a comfortable range and avoid pushing, pulling and heavy lifting. Remember, moderate intensity exercise with a warm-up and cool-down is a safe and effective treatment for your heart. Only ever do what is comfortable for you and seek advice if you have any issues or concerns.
The purpose of this video is to demonstrate the exercises that we perform in cardiac rehabilitation so you could use them safely and effectively at home. Please ensure you've read the disclaimer before you start the exercises and ensure you're feeling safe and well to exercise before starting. This program in particular is designed for patients who do not have joint problems or balance issues and are regularly active and are able to perform the 1 minute standing program with ease. We're now going to begin the warm-up, which is now an increased warm-up on what the 1 minute program is. We're just going to do it for slightly longer with bigger exercises, bigger range of movement, slightly higher intensity. Just going to start off with a gentle march on the spot. So all the movements are gentle to begin with. For the purpose of this video, I'm not going to use any external support. But you may need some support near you to hold for some of the stretches. Again, this is not an individually prescribed program, so some of the movements may not be appropriate for you. So if you're experiencing any discomfort during any of the exercises, please stop and keep to a comfortable movement for you. Just going to come into some gentle toe tapping now, so tapping the toes down, alternating with the feet. And back into a march on the spot. Just be careful with the next exercise. We're just going to take a little back tap. It's just alternating with back taps. It does challenge your balance a little bit more. So if you do feel like you need some external support nearby, please ensure you've got something sturdy to hold on to. Okay, and back into a march on the spot. Just going to come into a heel tap now, so tap it out onto a heel, pointing the toe up to the ceiling, alternating with the feet. Again, keeping it at a nice comfortable pace. And back into a march on the spot. Now we're just going to take a step out to the side, so alternating with side taps. Again, nice comfortable range of movement for you, comfortable pace throughout. And back into a march on the spot. Just lifting the knees up slightly higher now, be mindful of your balance with this one. And again, keep it to a comfortable range of movement for you. And back to a march on the spot. Just going to take a small step forward into a lunge. So we just put a little bit of weight through the leg, alternating with the feet. Again, this doesn't have to be a big step forward. And back into a march on the spot. Now we're just going to come into a knee bend, so just bringing your feet a little bit wider apart. Just sitting back into this one, sticking your bottom out, nice slow control movements. And again, just coming down to a point that's comfortable for you. And back into that march on the spot. So now that we've warmed up the muscles, just going to go into some gentle stretches, starting from top to bottom, just starting with the neck stretch. Just going to slowly turn the head to one side, back to the middle, over to the other side, and back to the middle. You're still keeping the feet moving throughout if that's comfortable for you. Just going to come in some shoulder rolls, up and back with the shoulders. And up and forwards. And relax the arms down. Just bringing the hands to touch your shoulders, have a stretch in front. Back to the shoulders, have a nice stretch up if you can. Relax the arms down. Just bring the right hand to the right shoulder, point the elbow up, stretching the back of the arm. You can use the other hand to guide that arm back a little bit further if that's comfortable. Again, remember not to push into any joint pain. Change over. And relax the arm down. Continue keeping the feet moving. We're now going to come into a shoulder stretch. Just reaching an arm across the body. Bringing the arm in closer with the other hand on the elbow if that's comfortable. And change over. And relax the arm down. Just outstretching the arms in front to give the upper back a little bit of a stretch. And then bring the hands to the small of your back, just to stretch the chest. Keep that comfortable for you. And relax the arms down again. Just going to bring the feet a little bit wider apart again, hands up to chest height. Just slowly moving your weight from side to side. Just going to slowly twist now to one side, reach back with the arm if that's comfortable. And if you have space to do that, change over. And back into a march on the spot. And again, just bringing your feet about shoulder width apart, hands down by your sides. Come into a gentle side bend. Down to the other side. And one more time each side. And then back into that march on the spot when you're ready. Just coming in some side stepping now, so stepping both feet out to one side and back in. And then we're just going to step out, plant the feet so you've got a nice wide base of support there. Just going to slowly transfer your weight from side to side. Nice slow control movements, and we're just going to hold it on one side. And slowly over to the other side, hold it there, and back to the middle, and back into a march. The next exercise we're going to perform is a thigh stretch, so you may need some external support for this with the use of a chair or kitchen worktop, wherever you're exercising in the house. Just make sure you've got some support nearby. This one does challenge your balance. So we're just going to tuck the foot back behind you. If it's comfortable, you can maybe hold the trouser leg or the foot. So just keep it comfortable, keeping the back up nice and straight, knees fairly close together, and hold that stretch. Pop that foot down, gentle march in between, and change over. And relax the foot back down, back into a march on the spot. Just going to take a small step forward into a lunge again. Again, alternating with the feet. Again, you may need to steady yourself with a chair. And we're just going to step forward now and hold that stretch. So we're keeping the weight on the front leg, back leg nice and straight, heel planted on the floor. Just keep some weight going through that back heel, and you should feel the stretch in the calf. Okay, step back slowly, gentle march in between, and change over. And back into a march on the spot. Just going to come back into those heel taps one more time. And this time we're going to step onto a heel and hold it for a stretch. So we're keeping the toes pointing up, keeping that leg nice and straight. And if you want to increase the stretch, just ease forward to a point that's comfortable for you, keeping your head looking forward. Hold that stretch. And step back slowly, gentle march in between. And we're going to change over. Again, stepping out onto the heel, easing forward if that's comfortable for you. You may find it's enough of a stretch, just standing upright. If that's the case, just hold that stretch. And step back slowly. Back into a march on the spot. Now that we've gone through the sequence of stretches, we need to go into a re-warm. So just starting to increase the intensity slightly. So we're going to go back through the same sequence of movements. Now starting to bring in some arm movements at the same time. Keeping it comfortable for you throughout, moderate intensity. But bringing the arm movements in will make you feel like you're working a little bit harder, maybe getting your breathing a little bit heavier, and getting you feeling a bit warmer. As long as you're still feeling comfortable and you can still hold the conversation throughout, then that's fine. That's the intensity we want. So we're going to start to come in some gentle toe tapping. Now that you have warmed up and stretched, you can maybe start to go in some bigger movements. Stepping out a little bit further, and if it's comfortable, you can start to bring the arms in. And back into a march on the spot. So now we're just starting to lift the feet up slightly higher, bringing in bigger arm swings as long as that's comfortable for you. And we're going to go back into those back taps again, so just take your time with this one first, just steady yourself if you need to. It does challenge your balance a little bit more. And if it's comfortable, you can start to bring in some arm raises at the same time. Again, if this is starting to compromise your balance, just come back into the foot movements or steady yourself with the chair if you need to. Whereas we're trying to increase the intensity for the purpose of this video, I'll be bringing in the arm movements. And back into a march on the spot. Again, slightly quicker movements, slightly bigger movements as long as that's comfortable for you. And we'll go back into those heel taps one more time. Again, slightly bigger movements if that's comfortable for you. Started to bring in the arm movements. And back into a march on the spot. Just going to come into those side taps one more time. And again, if you've got space for this, and as long as it's not challenging your balance too much, you can start to bring in some arm raises at the same time. So again, if this is starting to make you feel like you're working too hard, if you're getting short of breath, just slow down the movements, just come back into the leg movements and come back into your comfort zone. and back into a march on the spot. Just going to lift the knees up slightly higher again. Again, working within your limitations. Keep it comfortable. And back into that march on the spot. And then we're just going to come into a knee bend one more time, bringing your feet a little bit wider apart. And again, sitting back into this one. If you want to, you can raise the arms in front at the same time. And back into that march on the spot. Okay, now that we've performed the warm-up, we're now going to start the circuit. For this purpose of this video, I've chosen a stronger strength band, so we're using the blue band and heavier weights, as this is our level 3 exercises, so it's a higher intensity that we're performing. We're going to start with some marching on the spot, and the first exercise we're going to perform in the program is your bicep curls, so you're going to need your weights for this exercise. So as you did in the level 1 and level 2 exercise program, tucking your elbows in your sides, keeping your feet moving at the same time, and then we're going to start the 2-minute timer, starting off bringing your hands up towards your shoulders. So again, keeping this comfortable pace for you. Remember, we're performing this now for 2 minutes. Some nice slow controlled movements. Remember to pace yourself, keeping your posture nice and upright, nice relaxed breaths. And again, for some of you, as long as you're comfortable, you can start to increase the intensity, so maybe some quicker movements with the feet. Or we can come into some slower movements as a recovery period. The upper body movements in this video are designed to be an active recovery station. So you should feel like you're recovering after you've done a cardiovascular exercise, which is predominantly leg exercises, which would be your next exercise. So remember, these exercises can be performed for 1 minute, 1.5 minutes, or 2 minutes, whatever's comfortable for you, whatever time you have. Remember, in this video is a progression from the level 2 exercises where we showed a 1-minute video. Again, remember, you can choose your weights at home. You can buy weights in Tesco's or Argos, or you can just use simple things you may have at home. So tins of beans, bottles of water, bottles with sand in it. You could still use for the resistance. So we're just coming towards the end of the 2 minutes, and then we'll be going on to the next exercise, which is step-ups. You hear a 5-second counter, and then we're moving on. Remember, you can top up on fluids throughout. So the next exercise, you'd go to the bottom step of your stairs, and now you'd be performing the step-ups as we would in the cardiac rehab class, up and down, alternating with the feet. Again, go at a nice comfortable intensity for you. You may want to hold on to a banister rail. And again, just as the 1-minute exercise program we showed you, if you don't have steps at home, you can maybe come into some high knees. And again, remember, this is a progression from the 1-minute circuit exercises. So we're starting to increase the intensity as long as that's comfortable for you. Remember, it's moderate intensity exercise throughout. You'll still be able to hold a conversation. Remember, it's back into the step-ups if you do have a step at home. So it's just up and down on the bottom step of your stairs. And again, for some of you, you may want to go at a slightly quicker intensity, as long as that's comfortable, and as long as you can still hold the conversation. If you notice you're getting a bit short of breath, just come back into your comfort zone, back into a normal step-up, or you can start to come into some toe tapping, just to slow down your breathing and come back into your comfort zone. Okay, so remember, for these exercises, which is the leg exercises in the program, these are the exercises that are designed to get you breathing a bit heavier, getting your heart working a bit faster. And the next exercise we'll go on to is an arm exercise, which is designed to be a recovery station. So just getting your breath back, still working throughout, continuous movement. And we're about to hear the 5-second counter. Okay, so for the next exercise we need our resistance band. And again, just as in the other exercise program, going to wrap the band over the shoulder, keeping your feet moving on the spot, just fixing one hand to the sternal area and the other hand just below, so it's fairly close grip. So we're working the muscle at the back of the arm, the tricep muscle, and so all we're doing is pulling the band down. Nice slow controlled movements with the arm. And again, as you're straightening the arm out, you should be feeling it in the back there. So again, we're still keeping the feet moving, but if you want to alternate and just bring in some toe taps instead, some of the warm-up movements we did, that's fine as well. Or we can just march on the spot. Okay, we're going to change to the other arm now, so we're just going to switch. So bring the other hand up on top, and the other hand just below it now. And again, just starting with the arm pull down, so trying to straighten the arm out, working the muscle at the back of the arm. So these movements that we perform with the resistance band, they're mimicking gym exercises. So in a gym, you would hold a bar, bring the bar down to a certain point, which would be attached to some resistance, and that's how you'd work out in the gym. We're just going to use the resistance bands to perform the same movement, and just using the resistance from the band. So during this time now, you should feel like it's been some recovery, your breathing should have settled, and then we'll be going on to another exercise which will be working the legs. So we're about to hear the 5-second counter. Now you can pop your band down. So for the next exercise, we are going to start to increase our heart rate and breathing again, keeping the feet moving on the spot before you start. And now we're going to come into some lunges. So as we did in the warm-up, we're stepping forward, alternating with the feet. You may need some external support near you to steady yourself. And again, keep it comfortable, work within a comfortable range of movement for you. The idea is now that we're in the main part of the circuit, we are starting to increase the range of movement now that we've warmed up. But again, keep this comfortable for you. Moderate intensity throughout, still able to hold a conversation. If you want to use some weights during this to make it a little bit harder, you can. Again, as long as it's comfortable for you. So again, as we're stepping forward, we just got the weights in our hand. Or if you want to, you can bring in a bicep curl at the same time. Remember, you can have a rest period at any point during this program. Just keep your feet moving. If you need to have a drop of water throughout, you can. Just stop and have a rest. Just keep the feet moving gently. Help yourself to a glass of water and then resume the program. Again, if you do suffer with knee pain, you may want to change to a little back tap during this one, as there's less strain on the knees. Again, keep every movement comfortable for you. Okay, so we're going to move on to another active recovery exercise. So for this one, you're going to need your weights again, still keeping the feet moving on the spot. This again is designed to be a little recovery station, so just allowing your breathing to settle. This one, we're going to bring the arms out to the side, keeping the feet moving gently. And again, keep the range of movement comfortable for you. And again, if you're still within that 12-week recovery period after open heart surgery, you may want to adapt your range of movement, so come a quarter of the way, or even just keeping your arms a little bit closer to your body. Again, after that 12-week recovery phase, you can start to increase your range of movement as long as that's comfortable. It can take a little bit longer to heal sometimes, so always work within your limitations. So remember, nice slow controlled movements throughout, nice relaxed breathing, good upright posture. Try and remember all those points. Okay, so we're about to come into the 5-second counter before we go on to the next exercise, which again is another leg exercise. So we'll now go on to squats. Okay, so you can pop your weight down. For this one, like we did in the warm-up, we're just going to sit back, okay, sticking your bottom out, come back up nice and slowly, okay. And as we performed in the 1-minute circuit exercises, if you'd like to have a gentle march in between, just to give the knees a rest before you resume the exercise. Again, trying to keep the heels planted on the floor. Nice relaxed breaths. Again, you may need some external support near you to hold on to, a chair or a worktop, something nice and sturdy that's not going to move away from you. And a good reference for this exercise I always find is to have a chair nearby, so your bottom is nearly touching the chair, and slowly back up if you want to go into a deeper squat. And again, another adaptation to make it a little bit more difficult is to hold the weight in hand and then use the squat position with the weight in hand. Or again, like we did in the warm-up exercises, you can just raise the arms out in front. And again, remember, if you want a breather, just have a gentle march in between. Help yourself to some water. Just keep the feet moving gently. Have a little walk around if you want to before we resume the exercises. And again, just come back into that squat position. So we're bending the knees, sticking the bottom out. So it's the same movement as you're about to sit down. Again, we're about to come into the 5-second countdown, and we'll move into another upper body exercise. So back into a march on the spot. You're just going to need your resistance band for this exercise. And again, we're just going to wrap the band around your back. So it needs to be fairly high up the back there. And again, just keeping the feet moving on the spot. Just going to push the band out in front. Nice slow controlled movements. Again, nice relaxed breaths. Try not to hold your breath. Keep your back up nice and straight. And again, with the bands, if you want to increase the resistance, you can just bring your hands a little bit further down towards your body. Just increases a little bit more resistance, a little bit more tension. It's like adding an extra weight. Or if you want to make it a little bit easier, just bring your hands a little bit further away from you and just releases a bit of tension. Just keep it comfortable throughout. Remember to pace yourself. And again, if you find the foot movements uncomfortable, the repetitive movements, you could go into toe taps at the same time, or some heel taps, as long as that's comfortable for you, or just a gentle march on the spot. You could also just come into some heel lifts during this time, just to take a little bit of tension off. Remember, this is more of a recovery station. Or just back into a march on the spot. Again, for some of you, may be comfortable enough to come into a bit more of a vigorous march or a brisker march. As long as it's moderate intensity for you and you can still hold a conversation and you feel comfortable, that's fine. Okay, so you're about to hear the 5-second countdown again, where we'll go on to another cardiovascular exercise where you will be breathing a bit heavier, working your heart rate a little bit more. Okay, so you can pop your band down now. So this is the sit to stand exercise. Again, just remember with this one, you need to be in the front part of your chair before you start. So in the front third of your chair, and we're just trying to get the weight forwards and pushing up before you start. If you've got a chair without armrest and you don't need to use your hands, that would be ideal. Just using the leg muscles would be great. So we're just going to sit forward, transfer the weight forwards and stand back up. And then sit back down. And again, trying to sit slowly without using your hands would be great as well. And sit back down. But if you do need the support of the chair, you can use your hands to push up from first of all. And then if you can, progress to without using your hands eventually. Again, as we demonstrated in the 1-minute circuit exercises, as you come up, you could have a gentle march in between, gentle recovery, less load on the knees, giving them a bit of a break before you come back into another sit down. Again, slowly standing back up and really controlling your sit down as well. So really control it and back down. And again, as we did with the squats, you could progress it to using a weight at the same time and sitting and standing up at the same time with the weight. And again, you could have a gentle march in between, a little bit of recovery before you come back into the sit to stand. Okay, we've got 2 exercises remaining. So you're about to hear the 5-second countdown again. The next exercise we're going to need our weights for. We're going to work the upper body. So just keep the feet moving on the spot once you come back into standing. Take your other weight and we're going to come back into the upright row. So bringing the weight up the body, elbows out to the side, keeping the feet moving. Again, as demonstrated in the 1-minute circuit exercises, you could also use your TheraBand. So for this one, again, we're using a stronger strength band. Popping the band onto the floor, holding onto it in both hands. Step 1 foot onto the band. And again, you're just bringing your hands up the body, elbows out to the side. Obviously with this movement, you're unable to keep your feet moving. So in between, you could come into a gentle knee bend, back up, upright row, and a gentle knee bend. Or alternatively you could use your weights and just keep the feet moving. Again, bringing the elbows out to the sides. Nice upright posture. Relax your breathing. Nice slow controlled movements. And again, you could go into some toe tapping at the same time, just to change up the movements with the feet. Or some heel tapping. Or just gentle movements, just lifting your heels up from the floor. Or for some of you, you may want to continue your marching and keep it fairly brisk. Again, as long as it's moderate intensity and you feel comfortable throughout, continue. Okay, so we're going to move on to the last exercise in the circuit, which is marching on the spot. So again, we're obviously increasing the intensity in this video, so we're just lifting the feet up a little bit higher, maybe bringing in some bigger arm swings. Again, keep it comfortable for you. Obviously slow the pace down if you become a little bit short of breath, or if you're getting a little bit fatigued. And again, you can just reduce the intensity even further if you're just catching your breath. Just do some heel lifts, wiggling the toes, just keep your feet moving, just reduce the intensity. Again, if you're comfortable, you can increase the intensity. And there may be some individuals watching this video who may feel comfortable to jog on the spot. But as long as you're feeling comfortable, if that's a regular exercise for you, or if you have a long-term goal of getting back to jogging or running. But for the purpose of this video, we're going to keep it a steady pace, moderate intensity. Again, for some of you, you may want to hold on to your weights at the same time. And still going into that marching, increasing the intensity, just lifting your feet up slightly higher, bigger arm swings. Again, keeping your back up nice and straight. Thinking about your posture throughout, and nice relaxed breaths. We've got 25 seconds to go to the end of the circuit, and then I'll be going into some gentle cool down exercises, just reducing the intensity, slower movements, smaller movements before we stop. Okay, so the last 5 to 10 minutes will just be nice relaxed movements, just repeating the same sequence of movements that we did in the beginning, but at a slower intensity. Okay, so that's the end of the circuit. Just keep your feet moving now, have a gentle walk around your living room or wherever you're performing these exercises. Help yourself to some water. Just really slow down your movements, don't stop suddenly. Just keep the feet moving very gently, gentle walk around. Have a drop of water, allow your breathing to settle. And now we're just going to go into cool down exercises. So starting off with some gentle toe taps. Again, we're slowing everything down now, much smaller movements. And a gentle march on the spot in between. Just going to perform that gentle back tap again. Again, just be careful with this one, take your time. Steady yourself if you need to. And back into that march on the spot. And we're slowing it down now, smaller movements. Into those heel taps one more time. And a gentle march. Perform the side tap again. It's just working all those different muscle groups in the legs. And a gentle gentle march. Just lifting those knees up slightly higher in front again. Again, work within your limitations. And back into a gentle march. Just going to take a small step forward into a lunge again. Again, smaller movements now. Really slowing it down. And back into a march on the spot. And then just a couple of knee bends, so bring your feet a little bit wider apart again. Some gentle knee bends. And back into that march. So we're just going to finish with some stretches. Now again, starting from top to bottom, just keeping your feet moving gently as we perform these stretches. Again, you can come into some heel lifts, or just wiggling the toes throughout, whatever's comfortable for you. If you can, just keep the feet moving gently. Starting with a neck stretch, just going to slowly turn the head to one side, back to the middle, over to the other side, back to the middle, and into those shoulder rolls, up and back with the shoulders. And then up and forwards. Relax the arms down. Just bring the hands to touch your shoulders, have a little stretch in front, and then back to the shoulders again. If you can, try and have a nice stretch up. Just relax the arms down. Just bring the right hand to the right shoulder, point the elbow up. Again, you can use the other hand just to guide it back a little bit further if that's comfortable. Again, not pushing into any joint pain. And change over. The arms down. Just going to give the shoulders a stretch again, so reaching an arm across the body. Again, you can bring the other hand underneath to guide her in a bit closer. Again, being careful not to push into any joint pain. And change over. And relax the arms down. Just going to stretch the upper back area again, so just outstretching the arms in front. Hold that stretch there. And then bring the hands to the small of your back just to give the chest a gentle stretch. And relax the arms down. Just bring your feet a little bit wider apart again, hands up to chest height. Just wiggling your toes or just moving your weight slowly from side to side. Just going to slowly twist back and reach with the arm. And over to the other side, and back into a gentle march on the spot. And again, just bringing your feet a little bit wider apart again, hands down by your sides, just come into a gentle side bend, and down to the other side, and just do that one more time. And back into a march on the spot. Again, smaller movements now, slowing it right down. So we come into some side stepping again, so gentle side steps to one side and back in. And step out, plant the feet so you've got a nice wide stance. Just slowly transferring your weight from side to side. And hold it on one side. The other side, hold it there, and back to the middle, back into a march on the spot. You come back into that thigh stretch again, so you may need to hold on for support for this one. Again, just tucking the foot back behind you. If you want to hover the foot there, you're still getting a stretch there, that's fine, don't force the stretch. But if it's comfortable, again, you can either hold the trouser leg or the foot. Again, try and keep the knees fairly close together, back up nice and straight. Okay, gentle march in between and change over when you're ready. Again, keep it comfortable for you, don't force the stretch, try and keep the back up nice and straight, knees fairly close together, and hold on for support if you need to. Okay, pop the foot back down, gentle march on the spot. Just going to finish with a couple of leg exercises now and stretches. So just coming into those lunges again, stepping forward slowly, alternating with the feet. And now we're going to step forward and hold it there for the stretch. Again, just keeping the weight on that front leg, back leg nice and straight, keep that heel planted on the floor, and you should feel it in the calf there. Just hold that stretch. Step back slowly, gentle march, and change over. And step back slowly into that march again. Just finishing with those heel taps now, just pointing the toes up again. And this time we're going to step out onto a heel and hold it for the stretch. Again, keeping the toe pointed up. Again, that might be enough of a stretch for you. If you want to increase the stretch, just ease forward slowly. Just keeping your head looking forward. Step back slowly, gentle march. And change over. And step back slowly. Just going to finish by alternating some heel lifts. So you're slowly just peeling your heel from the floor. Really slow, gentle movements now. Your breath should really have settled now by this point. And then we're just going to finish with a couple of nice relaxed breaths. So just bring your feet a little bit wider apart, relax your posture. Just going to take a nice breath in through your nose and out through the mouth. And do that a couple more times in your own time there. And relax. Okay, well done everyone. Just remember that exercise is safe and effective for your heart as long as you're working within the parameters that we're setting and you keep into a comfortable, steady pace that's moderate intensity for you, and you should be able to hold a conversation throughout. Remember, this exercise video is designed to show you a progression from the other two videos, and you should feel like you're competent to perform those exercises before starting. Remember to top up on fluids throughout and help yourself to a glass of water now.